I'll start that statement again. So one of the really key important pieces to the work of the funds is in community engagement. And when we think about community engagement principles, the ones that we have listed here include early involvement, respect, sustained collaboration, transparency, inclusiveness and equity, and trust. And all of those are built in as really key drivers in the work of community engagement and how you engage community. You know, respect being that all participants, include staff and residents, demonstrate and in return feel respect as well. Decision-making approaches are made with an open mind, and the participants really feel comfortable sharing their thoughts and feedback. Trust is also very important, and the idea is really we're having meaningful conversations, following through, accountability for what we say we're going to do. And so those are really important when we're dealing with, when we're engaging with a community of folks. Transparency, you know, that we're acting with integrity, that we have an open process, you know, and that we provide timelines and clear, trustworthy information is really key to this work. Talked about early involvement, and early involvement is really important, identifying and engaging those key stakeholders in the early part of decision-making process. So community members are involved in kind of framing issues before any conclusions have been drawn. Inclusiveness and equity, we're really talking here about reaching out and encouraging the participation of all members in the community in conversation and decision-making process, including those people who are most impacted by the issues and who've historically not been engaged. So that's another key community engagement principle. And last, but certainly not least, is sustained collaboration, where we're doing all this community engaging work, we're investing in long-term working relationship, learning opportunities, sharing results and finding, open collaborations with participants and community members and community groups. And so again, we're talking about long-term investment in relationships. So it's not that now that we're done with this particular project or this particular work, we are no longer connecting with you. We're there, you know, we don't have anything to do for you anymore. We're not holding any meetings, so we're not engaging. You're still finding out ways to engage with the community, whether it's you attending events there or other mechanisms. But when we're thinking about authentic, true engagement, this is some of the piece that we're talking about. Next slide, please. And so when thinking about how we're defining community and community engagement, we have our definitions here with community. And a community can be defined broadly, both geographically or population-based, among people with shared identity, affinity, or affiliations. And when we're talking about and defining community engagement, it's really the process of working collaboratively with and through groups of people affiliated by geographic proximity, special interests, or similar situations to address issues affecting the well-being of those people. You know, so again, it oftentimes it involves partnership, working with coalitions, with residents, those most impacted, to help mobilize resources and influence different systems, change relationship among partners, and really it's serving as a catalyst for changing policies, programs, and practices. And that's the CDC's definition when they think about community engagement. And so it's really just this powerful vehicle for bringing about policy, system, and environmental changes that will help improve the health of the community and its members. Slide. And so the application has I will say this is one question that we ask related to community engagement. However, if you're paying careful attention, you'll notice that it's still questions around engagements that's tied throughout all of the questions that we're asking. And so for this, we say, who are the people and communities that you serve? And this seems like oh, well, we serve this, and this, and that's it. However, there's a guiding statement around this to please share the specific ways you engage or plan to engage populations with lived experience of the issues you are addressing in the leadership, design, implementation, and evaluation of this work. And so it is really important that you consider and you think about this question and not just think about the immediate folks that you're working with to do this and to answer this community engagement process, but think about ways that you, if you don't already do this, way that you intend on reaching out to those with lived experience to get them to the table so that they are a part of your, designing. They are a part of your implementation of this work. They are a part of understanding the evaluation component. They are in attendance at community events and meetings that you are having, and that you're engaging with them in a way that's really thoughtful, that's looking to help enhance the work that you're doing, because the level of expertise that the community brings into the space, especially with that lived experience, is really valuable in moving your work along. And so that's a key expectation for you to really delve into that question and to really think about what that process is and how you do it thoughtfully, or will plan on doing it very thoughtfully within this particular application. Next slide. And so here we have a variety of different ways that I'm sure folks have seen this work, but this is the public participation spectrum. And so really what you have on top is just the words inform, consult, involve, collaborate, and empower. And you see with each of these words, the arrows are moving in different directions. And in some instances, you see on the left hand of the screen, like low level of public engagement, or what's considered lower level of engagement. And that's in the inform and consult realm. So this is things like holding a meeting where you're sharing information, or holding a meeting and you're getting information from the community. So that's under that inform and consult. And then when we think about mid-level ways of public engagement, we're thinking about involving. So you're working directly with the public. You're thinking about the inputs that they're doing throughout the process. As we move further on to the spectrum, we're moving into that collaborate and empower space. And so when we're thinking about collaborating, it's you're engaging the public in key activities and decisions during the process. And then the empower line is you're implementing what the public decides. And so this public participation spectrum just really talks about the different levels and various ways in which you engage folks. And it's not necessarily that it's one directional, that you're going to move from inform to consult to involve, collaborate, empower in that particular order. There's a variety of different ways where sometimes you will have to go back into the informing mode, or go into collaborate mode, or go into involve mode, or consult mode. But the idea here is that you see this different spectrum and you're thinking about ways when we're talking about deep community engagement, you're thinking about ways in which you are going to connect deeply with those that you're looking to engage, and how you're going to involve them in the process. Next slide, please. And so now with this particular piece, we're thinking about health equity and community and engagement. And health equity and equity overall and community engagement, they go hand in hand. It is absolutely necessary when you're considering equity that community engagement is right there in that space, in that place. And with this slide, it's really talking about community engagement can harness, and this is from the CDC, community engagement can harness the skills and talents of the community's most important resources, and that's its people. Involving community members in health initiative can foster connectedness and trust, improve assessment efforts, and build the capacity of individuals to positively affect their community. And so we'll be talking a little bit later, give you some examples of ways in which some of our current awardees have used this grant opportunity and how they're engaging their community to effectively make changes to the challenges and barriers that they're dealing with. And additionally, this engagement can enhance the effectiveness of proposed strategy and increase the sustainability of efforts. And again, sustainability is so key, right, to this work. And as we've talked about our policy system and environmental change approach to all of the funding streams, including PSC, CHIP, and healthy aging funding stream, we're telling folks we're moving upstream. And sustainability is key to that. But within that, your community and how you engage them is also going to be a big part of how you're able to sustain this work, right? If your community hasn't bought into the process that you're referring to, the process that you're doing, or they don't know anything about it and they're just coming to the table at the latter stage when it's all time to move things in and it's up and running, it's hard to sustain these efforts because community can't see their voice, they can't see themselves within this work. With that, I am going to pass it over to my colleague Chuncheon, and she's going to talk a little bit more about and define what we mean by lived experience and lived experience of oppression.
Thank you, Albia. Yes, so Albia has mentioned a lot about engaging people with the lived experience of oppression. Just want to give you some definition of those two categories. And lived experience is defined as someone who has lived or is currently living with the issues the community is focusing on, and who may have insight to offer about the system as it is experienced by consumers, for example, substance use disorder people, homelessness. And lived experience of oppression is the sum of an individual's past events and a personal history with the navigating system of power through their marginalized, oppressed identities or backgrounds. Lived experience is not defined only as one's first-hand experiences. A person's circumstances must have been filtered through encounters where their stability or well-being was negatively impacted by system oppression. Yeah, so when you are thinking about engaging with your community, we highly recommend you to involve people with lived experience and lived experience of oppression. Now we want to share a few examples from our current awardees on how they engage and empower their community. One example we have is some awardees, they provided leadership trainings to the residents to teach them how to advocate to the city council members, because many residents don't know. For example, like me, I'm not grew up in the US, and like I didn't know how to reach out to city councils, and that would be really helpful to have some trainings to teach people like me on how to talk to city council members. And another one is created a youth summer employment program. They built a curriculum for youth to work and be compensated, which help with increasing youth engagement in coalition meeting works. That's a great way to engage youth and empower them, train them, and help them to understand the issue and even engaging in coalition meetings. Another example is our awardee called a collaborative for educational services. This is a awardee located in Western Mass. They have this participant supports program. And so the value of this program is reducing barriers for historically underrepresented groups such as BIPOC, low income, and rural residents to participate in decision making. Two, ensuring that all partners who contribute to their work feel valued. And three, correcting for power imbalances between paid roles and unpaid roles. Four, honoring lived experience as expertise. Five, supporting community members to develop their leadership skills. So their current practice on this participant supports program, one is framed as honoring people's for their time, not as just hourly compensation or for labor loss. To anyone can opt in for a stipend who is not already getting paid to be present. The offer or guide for participants to decide whether they should take one, but as a staff don't decide for them. They normally offer $30 per meeting. Stipends and caregiving stipends are delivered via gift card, mailed to their homes quarterly, or available for them to pick up at their office monthly. We have some other resources want to share with you. This website called the Community Health Training Institute. This is a partner between Massachusetts Department of Public Health and HRA. We provide targeted skills development to individuals and teams working to build healthy communities in Massachusetts. They also customize their in-person trainings and webinars around core competences such as coalition building, leadership, policy, system, and change, community communications, health equity works, and youth development strategy planning and evaluation. They have a free training coming up on February 6th, called a Catering Aging Populations in the Public Health Agenda. We also have other TA coming up. One is on Wednesday about health, racial equity, and then next week we have a TA session about evaluation and the application portal and talking about the budget and work plan. On the 12th, we have an open Q&A session, so you can drop in and ask any questions that you have. Just another reminder of please visit our website for all the materials. We have all the slides and recordings listed on the apply page. We also have other resources under resources. We have the PSC change approach page, and that the one that we had last week. Many people wasn't here. If you're still interested, you can always go to that page and find out more. Please stay in touch with us at the Massachusetts Funds, MACHHA Funds at HRA.org. Feel free to ask us any questions. All right, now I'm open up for questions. Let's start.